Okay, so based on last time, or the other day, so we're continuing our discussion on the spine, just kind of continuing right where we left off. So if you've got your notes or you've got your diagram, just get that out. And if you don't have colored pencils, I suppose you could always use marker or something, but whatever's going to make the most sense to you. We're just going to continue right where we left off and see how far we can go. So the idea on this is we've covered the cervical region of the spine. So we've got a total of 7 bones there. The notable things to have down there is there's a large vertebral foramen, and we also have transverse foramen. The first two, C1 and C2, are the atlas and the axis. And again, as we talked about last time, when we have the atlas and the axis, that allows for the head to rotate, so we can rotate it to the left or to the right, only to about 180 degrees. So if you notice on this picture here, this part of the atlas is articulating on this piece of the axis, and then of course you've got the dens, which is in the middle, and that's going to prevent, it can only go against this so far. So and of course you've got the weight of the skull pressing down on the atlas at that point. So between all of that working together, this allows this whole bone to rotate back and forth, but it does not allow it to twist, and so you can only rotate it for so much distance. The vertebral foramen, that's where the brainstem would be. This would also be the openings, the transverse transverse foramen, which allows for the cervical and brachial plexus eventually, which eventually lead down to the shoulders. Okay, so that kind of gives you some idea of what we've covered so far. I think we had left off, not there. Let me go back. With the next region, which is the thoracic region. And I thought, there we go. And we've got 12 bones in the thoracic, so we have a large spinous process that allows for a lot of musculature to hold on and grab on, especially as those spinal processes overlap each other. And so kind of take a look at that here in a little bit. Actually, let me see if I've got something here. Nope, that wasn't it. Shoop. Okay, so I wanted to maybe show you this because I don't have this in a particular order, but I did want to kind of point out a couple things. So first of all, you've got the bifid spinous process. And I apologize for the handwriting, but that's the best I can do on the smartboard. So the bifid spinous process on the cervical, that's a clue. The other big clue is this large vertebral foramen, the transverse foramen there. This is the transverse process, kind of the sides, and of course this is the body. So if you need to in your notes or whatever you need to do to remember that, I'm putting TF in those. This is transverse process. The spinous process, okay, so that pretty much takes care of all of that, okay? So that's cervical. There, misspelled that, cervical. When you look at this one, over here to the right, this is a thoracic vertebrae. Thoracic vertebrae are usually characterized by a very long spinous process that kind of looks like a blade or a knife shape. We've got the body. This is turned on its side a little bit, but the body is just a little bit bigger, a little thicker than the cervical. And then you have the transverse process here coming out at you, but it's usually kind of short and stubby. And then there's places on this for the ribs, and that's what this articular processes are all about. Part of it is for a rib, and part of it is to attach to the thoracic vertebrae right below it. So characteristics, there's no foramen other than, well, maybe I need to put no transverse foramen. There is still the vertebral foramen that would be in, you can't see it from this view, okay, but the vertebral foramen would still be there. Okay. Wrong. Go back. So that's thoracic. Lumbar. Big thing on lumbar is a large transverse process. That's usually the notable thing. So lumbar would be in the lower region, down here. So from down this zone, if I can get my pen to work. There we go. Zoom. This is the lumbar region. And there are 5 bones there, 5 vertebrae. There are 12 here. There's 7 there. Those are numbers you need to remember. And when we look at them, we see a really noticeable, if I can get back to that page, here's the lumbar. Large body, because this is going to be bearing most of the weight of the body. Really thick vertebrae. These are the transverse processes, which are, you can't really tell from this view on human, but they're fairly blade-like, especially the spinous process here in the back is also blade-like. And again, this is where major muscles of the back are going to attach. In this zone is the vertebral foramen, okay, the hole for the spinal cord still. But this is about the point where when you get to L2, L3, we're changing from cauda equina, from spinal cord to cauda equina. So that kind of tells you a little bit of a difference between the size of the vertebral foramen at that point. But that's the lumbar region, okay? So there's 5 of those. Back, one more, okay? Sacral is the next region that we find, and that's way down here. Oops, 1C. Sacral. And they start off as 5 separate bones. So I'll put 5 to 1, if that makes sense. It starts off 1, 2, 3, 4, 5 down there. But it eventually forms one sacrum, which means shield. And that gives you a big clue as to what it looks like. And while I'm on this slide, I'll go ahead and do the last section. The 5th section is called the coccygeal. Sounds kind of weird. Coccygeal, which is 4 bones, which eventually form one coccyx, and that's the tailbone. The tailbone, which is fairly easily broken because it's just basically 4 little tiny bones. On a cat or some animal with an elongated tail, there would be lots of coccygeal bones. We have 4 that eventually fuse to form one true bone. Okay. Let me get to that slide so we can take a look at those. And in class, we would look at these each individually a little bit. So here's the sacrum. This is after it's already fused, so you can kind of see here transverse lines marking the former boundaries of individual vertebrae. So this would have been the fusing zone of two bones. This is a fusing zone of two bones, et cetera, et cetera, et cetera. Okay, so that shows you kind of 1, 2, 3, 4, 5 down here. Okay, and some ideas about what we have here that we can actually see. You have the sacral foramina or foramen. Foramina is plural, but that's what these are pointing to. So you have lots of individual nerves passing through these holes. The foramen, you don't need to know any other parts, but you should recognize sacral foramen or foramina is the plural. Coccyx is what it looks like after it's fused. 1, 2, 3, 4. Just kind of looks like this little dagger almost structure. And it's attached, typically it's attached directly on what's called the apex or the very end of the sacrum. Okay, and that's actually curved a little bit. You can't tell from this picture, but it's curved top to bottom a little bit, so it's actually in a kind of a shield or a cup shape. Okay, so those are the five regions of the spine that you're going to need to be familiar with. So make sure you've colored that on your diagram, and you've got those. You could if I had just some random vertebrae out in class, you should be able to identify roughly what each one, or which zone, which of those regions it would belong in. Okay. Things that can go wrong. So we'll call this disorders of the spine, some issues that could present themselves. The first thing usually has to do with weight. Normal weight is distributed along the spine based on curvature. So a curve is going to allow for more weight distribution than a straight line. So even as a fetus, we would have seen a curved spinal structure. As an adult, we have more than just one curve. We have the original curve that we had as a child, which is basically the thoracic curve, but you also have a curve inward at the neck, a curve inward at the lumbar region, a curve outward at the sacrum. So we're actually having 4 curves, and each curve kind of presents itself at a different time of the life cycle. So for example, the first you're born with. So when you're born, you basically have one curve to your back. Well, that doesn't really allow you to do too much of anything. You can just lay there. You can't even pick your head up off the floor. I mean, if they lay you down in a crib or a bed, you can't even lift your head up. Okay, you have no strength to your spine. You have to be held. You have to be carried. You can't do anything really for yourself. The second curve, so this cervical curve, you develop. So as you can hold your head up, your muscles are getting stronger, your muscles are pulling on your spine, and that pulls the spine into a second curve. So eventually you have the ability of holding your head up. If you've ever seen a newborn baby or a toddler, well, not even a toddler, but a newborn baby who's only a couple months old, they're still getting used to this big weight on the top of their head, and eventually they get more control, but initially you have to support the head because you don't want to just kind of flopping off to the side. No, it wouldn't actually fall off, but they could strain some muscles. Okay, so you always support the head of a newborn baby, but eventually they can hold their head up on their own. Third curve, down here, you get when you're crawling. So this the lumbar curve When you start to crawl, you push yourself up. And when you push yourself up, your spine is going to curve inward, just as when you were holding your head up, it curved inward. And that starts to create this S kind of curve, and that is going to allow for more weight distribution. When you start to crawl, as a baby, your lower lumbar region will curve inward to support that extra weight. And then finally, this fourth curve, this last curve, the sacral curve, you develop when you start to walk. And again, you're presenting even more weight on your spine because now I'm farther away from the floor. I have more of a gravity effect upon my spine, and so it curves outward again and inward. It's almost two curves there, but I'm basically curving the opposite direction of what the lumbar curve is. Okay, so it's basically going back to the original curve, but it's a more dramatic curve. Most spine disorders are related to some sort of irregular curvature. So this is the normal weight distribution, and that allows you to carry the load. The most common irregular curvature is called scoliosis. Scoliosis is a condition. We'll see if my link works here. Maybe. Scoliosis is a condition where there's a lateral curvature of the spine. So you can see there, this is actually a thoracic scoliosis, but it's also lumbar scoliosis. So I've got two pictures, and depending on where that curvature is, that determines the severity of it. But in this case, this is a view looking straight at the back, and it should be straight up and down, and it's not. So because of that, it's a lateral curve. Okay, so it's a sideways curve instead of being a curve vertically back and forth according to the back. It's a curve to the side, and because of that, there's going to be some significant issues. Sometimes it can be straightened, sometimes there has to be rods and pins. If you know Jade Music, I think that's her name. I think she's at CTC, or she graduated. I can't remember where she is in yearage when I record this, but the idea is she had some major surgeries in order to correct her scoliosis issue, and because of that, she has some permanent rods and pins in her back for the rest of her life. They'll never be removed. And the severity of it depends on if it's going to need that much correction or it doesn't. Okay. Second condition would be kyphosis. And kyphosis is sometimes called the hunchback syndrome or the hunchback condition. That's a condition where you have a exaggerated thoracic curvature. So we've got a normal spine pictured here, a kyphotic spine. We've got an exaggerated thoracic curve. So it's still the normal curve, but it's just an exaggerated form of it. And so it ends up looking like kind of a hump on the back. This can also develop, especially in older women that are developing some osteoporotic conditions. Their spine gets naturally weaker, and they'll develop this kind of hunched over appearance. Again, somewhat genetic. There's maybe some underlying causes that could also relate to this, including bone density, but that's what kyphosis is, a hunchback syndrome. Lordosis is a third disorder based on irregular curvature. Sometimes it's called swayback. We'll see if this one works. Normal spine, we have a curvature at the lumbar. This is an exaggerated lumbar curve called lordosis. So you can see on this picture of a young lady, little girl, sometimes it's called swayback. And again, this is an exaggerated curve. Again, underlying causes could be bone density. The spine is trying to manage the excess weight distribution, and somewhat corrective surgery, but again, some of that, it's not particularly life-threatening, but it usually will cause a lot of back issues. Okay? Some others, couple others. One is called spina bifida. This is one that's pretty picked up fairly early. Spina bifida is a condition where the spine does not seal correctly. So this, I mean, it's kind of a little bit of a shocking picture, but it's usually diagnosed very early. Usually as soon as the baby's born, it's noticed. And what's going on here, it looks rather odd, but it can be corrected fairly quickly in order for not to permanent damage. You've got the skin, you've got the vertebrae, and what's happened is instead of the lamellae, the two halves of the vertebrae fusing, there is a gap. And because there is a gap between the vertebrae sides, there is room for spinal fluid to build up. So you can have CSF building up within the dura mater. The skin would not cover completely that, so that's part of the fear, part of the risk is the spinal cord is very vulnerable in this state. Now they can surgically reduce the pressure of the fluid, get the spinal cord to go back in, and then seal everything up. They'd have to pull the lamellae of the vertebrae together. But someone who has spina bifida, that's what that's talking about. And I can go over that a little bit more in detail in class. Probably the most common case, I'll see if I can find a link to that. But herniated disc or a slipped disc is probably the most common thing that can happen to somebody's back or spine. And what's happened there is the spinal pads, the fiber cartilage between the discs has slipped out of place or herniated, and when that happens, it can pinch nerves, and that can cause excruciating pain as well. Okay, and we'll pause here. If we have another video, then I'll post that as well.